class. For the discussion on an EMS related topic on an how-to, we are going to take it back to basics and we're going to do basic CPR. We're going to break it back down to the EMT level because good perfusion in terms of CPR is really important and that can really help to save a life. I know that we're all advanced and we're all paramedics and we want to jump into our ALS techniques and push the drugs and get our dosages and et cetera, but getting down to doing good compressions and getting good perfusion that way is going to be really helpful. So it's always good to just go back as a little refresher and talk about what's important. So CPR, cardiopulmonary resuscitation. You come up to a patient, you realize they're not responding, there's no response from them, you're checking for your pulses, you got your carotid, your radial pulse, you've got nothing going on. Back, the old standard was, okay, head tilt, chin lift, obviously chin lift, no cervical injuries, you're given 2 breaths. Now, forget that, you're going right into compressions. That's the first thing you're going to do when you determine there is no pulse, both ends. I'm not going to get into, attaching the monitor, everything like that. We're just talking about CPR, getting good perfusion. So you're going right into compressions. You're doing 30 compressions. Your hand placement on this is pretty much center of the chest. You're going pretty much the nipple line. You're doing the hand over hand technique with the heel of the palm of your hand right there in the center. And when you compress, you're going about 2 inches is what the standard is. 2 inches of compression. When you're compressing, you're using your whole body weight. You're not just using your arms and just doing a bend like this. That's going to get you, the best compression possible for your patient. Important to note, all of us have probably done CPR at one time or another, but when you start your compressions, you might feel some cracks, some pops. That's, the ribs, the cartilage, all of that, it's going to break, especially on a very frail person. Don't stop. You're not hurting the patient. Keep going. That's what you're supposed to be doing. That 2 inches, that's, an approximate. On a really large guy, you might have to go a little bit further and you might not get those sensations that you're breaking the ribs or you're feeling stuff like that. That is actually where some of our advanced stuff comes into play, where you're looking at the monitor screen and seeing that you're getting good compressions on the monitor, but you should be able to tell that you're making enough effort to get some response there. So you're doing your 30 compressions. The next step to that after your 30 compressions is you are going to go over and you're going to do your 2 breaths. Even as an EMT, you're certified in knowing your basic O2 administration. You're going to use your BVM. You're going to have your mask. You're going to have your O2 hooked up, 15 to 25 liters per minute, and you're going to administer the 2 breaths. Once again, no cervical spine injury, head tilt, chin lift, getting a good seal, giving your 2 breaths. 1, 2. Not rushing, making sure that when you give these 2 breaths, you've got good chest rise and fall, you've got good compliance, and after you do that, you're going to go right back into your compressions. Another 30 compressions. That rate is about 100 compressions per minute. If you're here by yourself, you're going back and forth, you're doing 5 cycles, which should take you about 2 minutes. If, let's say, you've got a partner comes in, they're going to take over compressions for you so you can focus on the airway. Now, even as a basic EMT doing CPR, you can upgrade the airway. We're not talking going to an advanced airway, anything like that, but there are some tools that can help you get better compliance. Your OPAs and your MPAs. Basic CPR, you want to get one of these in so that when it is time to upgrade, you've confirmed, with your OPA there is no gag reflex intact. You pull this out, you can drop your ET tube down there. But let's go back to our OPAs on how to size and apply these. Corner of the mouth to pretty much the jawbone where it hits your earlobe. You size and apply like that. It should be that length. Alright? When you're placing your OPA in, your bevel side is towards the roof of the mouth, and then you spin it in, and it should rest like this on the teeth. Alright? Your NPA, you're always going for the larger of the 2 nares, and you're sizing it up similar to your OPA from the tip right here of your nose to the corner of your ear. When you're going in, like I said, on the larger nair, you're going to go